It's a very, very common condition. If you look at global numbers, about 1.6 billion people are hypertensive. And the scary fact about this is that about half of them don't even know it. And the other half, a lot of them are woefully undertreated and are put at risk of cardiovascular disease. What are the symptoms? Now, commonly, people think that when you have high blood pressure, you get headaches or you get palpitations. But actually, high blood pressure generally causes no symptoms whatsoever. So it sits along in the background, causing damage to your arteries because the high pressure damages all the arteries. And this is why we call it the silent killer. 4 key areas of your life that you can look at that will significantly improve and lower your risk of cardiovascular disease. The key areas are nutrition and weight, exercise, sleep, and mental health. If you are overweight, if you're sedentary, you have a terrible diet, and you have lots of things in your lifestyle that you can fix, then potentially you can reverse it. And classically, the patients that we see reversing their blood pressure are the ones that are overweight. So if you're 10 or 15 kilos overweight and you get your weight down to normal, which is achievable in 6 months or so,